So today is December 30th. So it's Wednesday. It's not our regular United Medical Day. So we wanted to actually do this earlier since January 1, we were going to be off. So this is our last event of this year. I asked Tanner to join me so then we can have the conversation on the COVID and the other related items. So I'm going to actually start going to our agenda items. So this is our session 18 for public. We are doing this for our patients and for people who live in the United States or anywhere else in the world. So they would all benefit from it if they speak English. So let's just start. We are going to go through the COVID updates, COVID vaccine updates, and our year in review. So now, unfortunately, it's kind of like difficult to make these in a way that just read these numbers are high. Hopefully, vaccine is going to be helping. But right now, we are at 20,119 total confirmed cases. So the number of people who died is about almost 350,000. These are really big numbers. So we are hoping that we can get this under control. And when we look at these numbers from Delaware standpoint, it's not, it doesn't look as bad, but we are a small state and then things can be, of course, better. And right now you can see the total hospitalizations as of today, that's 425. Current critical hospitalizations at 56, and then new positive cases about 420. So this time I actually added the graph for 90 days instead of the last 10 or last 14 days, just so that we can have a better perspective of what's happening. So this is percent of persons testing positive. 3 months ago, this number. So I'm going to actually bring the live data from the state website. The state did update their website, Tanner. I don't know if you saw that earlier today. Well, maybe it happened this week, but when I was trying to find my stuff, I couldn't. So I had to update some of them. So,
yeah, I think it had to have been either yesterday or today. I was having difficulty finding this stuff also.
Yeah. So, but now what I see here is like this current hospitalization 90 days. If you look at the numbers, so if we were at 83 averaging, and this is not like what's reported, it's like an average number. So right now that number is at 425. Now the winter season, we were going to be high on the hospital side anyway, but I think it's not helping. The current situation is not helping much. And the new hospital admissions, so that number did go up right after Thanksgiving. So we are probably going to have another bump here after New Year and the Christmas and New Year breaks. So we are hoping that we can get this under control now we have the vaccine. So here's the daily averaging, we were at 8%. 3 months ago, and then now it's about 23%. So that's almost 3 times more. So, and the new positive cases, 121 averaging 90 days ago, and then now we are down to, like after we went up to this bump, we are now at 627 almost. So just so then we can have a better appreciation for the numbers and understanding of the how these numbers did change in a very short amount of time. Again, I don't have to probably repeat it again. After the holiday, the numbers went up. We'll most likely see the same thing, right? Tanner, you see what's going on here. So this is Dr. Fuchs was explaining the other day. So that's kind of where the state number is. Now, if you were to go to the state website, they did update this this website, so that now it's more useful and I think more user friendly. And then they added current school planning scenarios here, so you can actually get a lot of quick updates from the state website.
Mm-hmm.
So now we are going to go back to our PowerPoint. So Tanner, you prepared this one for us. If you can please go through this.
Sure. This kind of goes hand in hand with the data that we're taking a look at and keeping regular updates with that's coming from the state. We just want to make sure we're taking a look at the data for our own patient population as well. So I've been running and making sure these reports are reflecting the most recent trends. So what we're looking at the bottom, we'll first look at this graph. This is just showing us how many orders are coming from our providers in our network for the state of Delaware. So that target line of 300 is where we ideally want to be to make sure we're getting and making sure we're maintaining a good grasp on the spread of the disease in our patient population. Now, we saw a little bit of a dip with that. As we know, we've had the holidays, as we've been mentioning. So we're seeing a little bit of a dip in the amount of orders that are going out as our offices might be taking shorter weeks. And in the most recent week, we're still obviously collecting that data. But we are still making sure we're hovering around the 300 mark, which is good. So that gives us a little bit more confidence in the numbers that we're seeing here above, which is showing us our trend in positive versus negative rates in our patients. So we're trending. Now that bottom number, 32.4%, is a little scary. It is still a little early, Kemal. We're still getting those resulted. But we do see an overall trend upward, which is makes us a little nervous.
Sure. One of the other things that I was going to bring up when we are going through the hospitalizations, as you may remember from our prior events, United Medical ACO hospitalization overall is not as bad as the way that Delaware total numbers are. So I do want to just bring that up again, just so that it is an important number for us. So let me see if I can find it very quickly. Let's see. Meeting. I think we had that from the PowerPoint for the providers meetings.
Believe so.
Right. The admission.
Yeah, I think that's correct.
Yeah, I see it here. So. Okay, so one second. Yeah, so this is, Tanner, this one is not the graph that Anthony is presenting, but just so that we can kind of see, our total hospitalization weekly average is not as bad as Delaware numbers.
Right.
There are several reasons for that. But I do believe that we are managing our patient population better. Right now, as you know, we started the research project for the patients with the COVID positives, just to go through their comorbidities, and then also working with our one of our cardiologists, who's also on the board of our ACO, Dr. Wasif Qureshi. He's actually guiding the research, so we'll be able to get some more data out of our own patient base. But it is a much better controlled group of patients that we are dealing with. I think we are managing our numbers much better, our hospitalizations much better. Like when the numbers were the highest, our numbers actually was lower. So this is 321, 377, 1221, 377. So our number did not go crazy with the way that state numbers did. And then this is why one of the biggest issues that we struggle these days is the understanding the outpatient settings. So like when I say the healthcare does not start at the hospital, so it should end at the hospital. So now when we were looking at this number, Tanner, if you can tell us what the progress on this one, so then I'll go back to the other issue again.
Sure. Yeah, this was a promising look at our data as well. Just showing this is something we've kind of talked about a couple sessions now. If you will all remember, we're really making sure we're keeping track of the amount of orders that we are resulting, as well as trying to follow up with the patients that we may not have orders or results for in the past few weeks. So those two bars other than the red, so looking at our yellow and blue bar, represent patients that we either were unable to get the test completed or decided to decline getting their test done. We're seeing drops in both of those numbers, which is great news, letting us know, and that's showing us that our patients are going forward and making sure they are getting their tests done, making sure that they're getting a result back rather than just letting that order sit.
So you know why that's happening, right? Because we are doing these live events and then we are educating our patients.
Everyone knows to go and get their tests done.
Yes, they understand the process now. Again, while we are going through this, another important number for Delaware is the total number of appointments we process. This is 11 months total, and the total number of unique patients. So, Tanner, what are these numbers? Like this 116, what does that represent for Delaware?
It represents a good chunk of the population of Delaware, which is really good news to see for the ACO. It really lets, we want our patients to know that we take care of a large majority, or not a majority, but we take care of a good portion of the population in Delaware. Like to think that.
So just from the population standpoint, it's closer to, like, it's somewhere from 12 to 15%, but from the actual sick population, patients who are going through appointments, it's probably 25-30%.
Correct.
Yeah. So now the updates that we have with the vaccine. So we put this together, and I believe it's going to be helpful for those who want to see these side by side. So Pfizer and Moderna, Pfizer, BioNTech, and Moderna. So the target population, there's not much difference. The 16 and older and 18 and older for Moderna. It's 2 shots. One of the biggest difference is the interval between 21 days versus 28. And what was the other one?
It was the temperature that which they're stored at.
Yeah, so the ships store at -94 Fahrenheit, which makes Moderna, in a way, is probably more practical.
Well, correct me if I'm wrong, Kemal, but I believe that that's usually about the normal temperature.
It is.
A lot of our vaccines.
For our other vaccines, absolutely are right. So, but other than that, in terms of the side effects, Tanner, actually, we did this for our providers meeting for Monday, right? So, so this is something that we put together. So we didn't see any big difference on the side effects. Most of our providers did receive the vaccine already.
Yeah, I'm actually I know we were discussing with Dr. Ergal earlier, as well as hearing from a few other providers that they have gotten their vaccines and are letting us know just that they were able to get it done, and that way we are still making sure we're pushing the message.
So, the vaccine is great, and we did have our video and just to support the awareness and understanding of the vaccine, putting our providers. When we did our event for the bariatric last week, I would say the last Wednesday, one of the most maybe disappointing picture that I saw, which I'm going to share soon, is something that actually made me question again, where the healthcare, where do we start receiving the healthcare? So now, Tanner, as you know, there's this perception out there. When you say healthcare, the first thing people think is the hospitals.
Hospitals, right.
We insist on the other way around. So what's your perspective of the healthcare, where it should be received?
Okay. Where it should be received? I think that, like you kind of mentioned, a lot of times when people first do hear healthcare, we think of those big hospital systems. We think of large open floors where people are staying, for extended periods of time, and they're going to the ED, they're going to those types of places for pretty normal basic healthcare needs.
Sure.
I don't think that what you're saying with the other end around the PCP, the primary care's office, is normally most people's first thought.
You know, the primary care is the backbone, and the private practices are the backbone of the healthcare system. So when you don't have any major issues, you don't just run to the hospital, and you shouldn't.
Right.
Because
Right.
hospitals are designed for certain ways to handle certain situations. We need them. We need them to specialize in what they do, but not in preventive care in a way that you don't want to go to an ED emergency room for things that should be done in the outpatient setting. Now,
Right.
I'm going to tell you why I was disappointed on this picture, which you kind of already know. First, I was really happy that Joe Biden is getting the vaccine. We have worked together in the past with his son as well, Beau Biden, not Hunter, but Beau Biden. This is a long time ago, and we wanted him to do well. And I was happy to see this picture. He's about my dad's age. So there's always that, kind of like I try to keep things together in different ways, just relate to them in a different way. So when I saw him getting vaccination, it was so good. But what was disturbing to me is, where is this vaccination completed, administrated? It's at the hospital.
Right.
And which hospital is the giant, CCHS? So now the logo that is behind this question mark, and you can see it here, and this is everywhere, right? So are we getting our president vaccinated, or are we promoting the hospital? Now, Joe Biden is my neighbor, so he and we live closer to St. Francis Hospital. So I can't help but ask, wouldn't it be better? One, because we go to the closest hospital, and also St. Francis has a lot less waiting time, by the way, in the ED, in case you have to go to, I hope no one needs to, but
it's good information to know.
They have a big sign on 9 to 5 with the ED time. But why would someone, we are maybe 2 miles from St. Francis Hospital. Why would someone go to the Christiana for this type of publicity?
Right.
So because Christiana is using this as, we are vaccinating. Christiana didn't find the vaccine, so they are still giving the Pfizer vaccine. But the way that they are presenting is like if this is something that they actually figured out. That's not the case. But St. Francis would be a better choice. You know where would be a better choice, Tanner?
Where's that?
VA hospital.
The VA hospital, you said?
VA hospital. Why? Because Joe Biden's son, Beau Biden, served in the army, and he was a really nice man. And it would be, if you have to go to the hospital to get this done, do it at the VA hospital.
Right.
But even better place would be one of the state agencies could have done this. But I was extremely disturbed and disappointed with the very commercial hospital logo behind Joe Biden's name. That shouldn't be. Our president should not be used for
and commercialized.
Absolutely.
Right. And aside from the commercialization and maybe the pushing of the hospital system, we have to think about the safety that's related to getting it done in the hospital system. As we kind of mentioned, I think a lot of people, when you think of hospital systems, they're not small individual practices, right? Kemal, they're large, expensive buildings where you're coming into contact with many more people. You're coming into contact with higher risks of infection, of not just COVID, but other bacterial-related infections.
Absolutely.
So I think that's a huge part of it as well. Yeah.
Where you don't have to be, you don't need to be. So
exactly.
Now we have some updates on the getting the COVID vaccine. Tanner, if you can tell us what's going on in terms of who's getting it. I know most people already know.
Yeah, so a lot of this information is coming from the state of Delaware, and Delaware Public Health is constantly keeping us updated with where they are in the vaccination distribution process. And as of this morning, I was reading that we're getting into, I believe we're looking here at the phases. We're starting to phase into this 1B section. They call it phase 1B. So a lot of our healthcare providers, healthcare professionals, and residents of long-term care facilities, they're starting to get through that phase. So we're starting to get into our elderly population. They have listed as 65 and older, as well as our frontline essential workers. And I believe reading through that, that's going to include a lot of our grocery store workers, first responders, people that are high risk and coming into contact with many different people on a day-to-day basis.
So between mid-January and end of March, most of the people that we have in this order, we should be able to finish the vaccination for them.
Correct. That's according to the plan that they have in place right now. That should be our timetable that we're looking at.
Yeah. So, Tanner, I do want to go through this issue that we discussed last week. As our patients know by now, that United Medical Clinic will not do the medication refills and certain things on the phone. And we are
starting next week.
Portal, right?
Yes.
So now you did actually pick this
this individual survey.
Survey,
yeah.
Right? So this patient is not really satisfied. The reason is because they are waiting on the phone for appointments or getting prescription. Well, they will be unhappy if they don't use the portal. Now, this graph, this table here is telling our patient that 58, almost 59% of the time, what we are being called can be done through the patient portal. So this is year 2000, almost 21. So
it's a few days.
Let's leave the 1967 in 1967. So from your phone, from your smartphone, you can use your patient portal and then get into habit of just using the portal, canceling your appointments if you need to, asking your questions. Patient portal is going to be a must, and then most of our other providers are going to follow United Medical from that point. Now, we also put something together just so that we can kind of summarize what we have done in 2020, since this is the last event. I personally believe we were able to manage this as good as we can. I do have to acknowledge the fact that federal government did help us a lot. They were so quick with the way that they worked. Senator Chris Coons was extremely helpful for us, for the businesses and for the people of United States. And we did actually bother his office a lot. And we want to thank him for everything that he has done for us. Our governor can do more. We represent 425,000 appointments, and yet we have not had a good partnership with the state in terms of the management of these patients. And I'm going to repeat that again and again. It can be done in a better way. It doesn't have to be this way. Now, what we did from our side, we have done 18 live sessions for our patients. And we are going to keep doing this. We may be on a slightly different schedule. We have not decided what would be the best frequency. We have right now, we are going to keep it on the weekly because there are so many updates we have on the vaccine and other stuff. And then Tanner is working on getting a sponsor for us so that we can actually make money from these. Now, Tanner, tell us about the provider meetings.
Sure. So our provider meetings, with most of things business related, we had to find a virtual platform, we had to find another way to go about meeting with our providers on a regular basis. We used to do this in person at least once a month when we were all able to get together. But that just wasn't something that we were able to do going forward. So we quickly did take this to a virtual platform, started really regularly. We were doing this just about every night on the onset of the pandemic to make sure we were all staying connected, staying on the same page, and getting information out as it came available. So we're still having them very regularly, twice a week, at least right now, to relate all things related to COVID, any important new news updates that are coming out that might be related or important for our providers to hear. So we're making sure we're maintaining this as part of our business culture going forward, which is really good to see.
Absolutely. And then we also have our bariatric events for patients with obesity. We have done 63 of those, and they are getting a lot of good feedback. And then we are going to keep having our Wednesday events at 3 p.m. And then first Tuesday of the month is going to be bariatric support group for CRIAS patients. And then also we have webinars twice a month that will continue. Now, one of the most enjoyable events that I actually learn a lot, and I'm not lying, I promise you, is the diabetes one. Because if you pay attention, you learn a lot for the day-to-day stuff that you don't have to be a patient to watch these. Amy is amazing, just like our other nutritionist friend and Beth. We do have different topics, and then we'll do twice a month in 2021 with different topics. We already finished the curriculum for the first 4 months. So, but it will be a good, exciting events for us. And we also do live sessions for our employees because we have some people who work remotely. We do have an office in Turkey. And of course, we are keeping everyone together with these monthly events and hoping that we can have a much better year this year in 2021. Now, Tanner, what am I looking at here? This says Tanner test. So,
just one of my test patients. What we're doing, this is going back to, really relates to the that report that showed us all the different reasons we're getting calls and how can they be handled through the portal. Well, here's a look at the portal for anyone who might not be familiar with it, who hasn't actually, just got put in the dark.
Oh, that's the
light went off. Here's a look at the portal home screen. So if you haven't actually been in here and you're curious as to just what you can do, looking down the left side here, it's all the different sections of your portal where you're going to be able to see your health information, see test results right away. You're going to be able to communicate with your provider. You're going to be able to update your demographic information. So a lot of that stuff that you mentioned in our report showed that the different reasons we're getting calls and that our call center is taking down in their call logs. These all can be things that you can handle through the portal. So this is actually a look at it on the internet. I think that's one thing we should mention or may not have mentioned, that you can do this right on the web. So you can do it from any computer you have, but we also, of course, have the Healthy Life app. So there's many different places and ways you can access this information. And it's really made, built for just about anyone, any type of patient, any age, any type of demographic. You're going to really be able to get a lot out of this.
Sure. Now, so, you know, the one of the issues, Tanner, I was not going to bring this up. It's not on our agenda, but I have to. So
sure.
It's not directly related to us here in the United States, but we are responsible and we have the awareness of what's happening in the world. So it's not just us, what's happening in our neighborhood.
Right.
As you know, Dr. Erkan, our vice chair of our ACO, one of my best friends. He's our partner at this center, as American Surgery Center, our clients of 18 years, but mainly a person who is very important in our lives. He brought up this issue to me. He made me aware of what's happening. And sometimes we get so busy and just see what's happening here in our neighborhood, but the life is a little bit different. Now, although it's not directly health related, it is society, community related, and I do share these from my personal Twitter account, and I do want to bring this up to people's attention, what's happening in Ethiopia today. So there is a Tigray region. I have actually posted a lot of stuff for people to understand what's happening. We have reached out to Senator Chris Coons, Tom Carper, and some of the other senators outside of Delaware. And we are going to continue doing this outreach to make sure that there is a good awareness. There's almost a genocide happening right now. So for those who may not know, in the United States, we are kind of like, we don't know much about other countries, especially if they're on the other side of the ocean. So Ethiopia is a huge country. It's about 100 million population. And there is an issue in one of their states. I believe there are 10 states, and then this is one of them, Tigray. So right now they were going to go for the election, and they decided not to be part of it because of the COVID. So they actually went for the election for the local, and it created a huge problem for the federal government. And now they are shut down pretty much out of the world. Like they don't have internet, they don't have no access to anything, and we don't know how many people are killed. And I personally am going to be following this with Dr. Erkan and then make sure that we get enough attention from here, so then before it's too late, we actually understand what's happening. So this is, again, like 110 million people in Ethiopia, and Tigray is about like 6% of the population. It's one of the big states. So the situation is extremely disturbing. I have not done this type of I didn't cover this type of topic just so that we keep this for our patients. But if we let certain things happen like this in this world, how can we actually just focus on our own health? So like, what would be the meaning of being healthy if people are just dying in front of us? And then if we have power to stop these types of nonsense. Now, Tannen, I don't know if you are following me on this one, but the guy, the Prime Minister, is a Nobel.
He was a Peace Prize winner, right?
Yes, peace, yeah. And it's what I find this so interesting is, so here you are recognized by Nobel, and then you are killing people. So we will actually be following this, and then I am expecting our senators to reach out to us. And I know some of them are already working on different bills, but this requires attention, and we have responsibilities. Great power comes with great responsibilities, right? So I know it's kind of maybe cheesy Spider-Man, but it's a really important way of understanding what our responsibility is. Just like we don't abuse anyone who's not as strong as we are, because we have responsibilities, we also have other responsibilities to make sure that we help people, other countries around the world, especially when this is going to become one of the biggest issues of 2021. I hope it's not too late. So
thank you for sharing
following that, and sorry for getting out of the regular agenda, but I just this was one of my items that I was kind of just debating whether or not, but I'm glad that we did. So So that's all we have for tonight. We'll be back next week, 2021, next year, on Friday. Friday noon will be our regular events. Bariatrics at 3 p.m. and others. You should follow us on our social media channels so that you can get the latest updates. I never said that I was going to say this because I used to make fun of this, but please subscribe to the channels so you get the updates directly. So this is the best way to support us and support the communication. And we'll see you next year. Well, Happy New Year. Bye-bye.